Welcome, I am Altered Component, and today we are going to go completely off script and we're going to talk about my LASIK journey. But before we do that, let's go ahead and spin that intro. Alright, so here we are, and I am 4 days removed from LASIK surgery. I just want to share my experience in kind of an off-the-cuff, unscripted vlog type video where I talk about my experience, what I had to do to get LASIK, what is LASIK, where I am in my recovery. Again, I am Altered Component, and if you're not familiar with me, I run a crypto mining, tech, hardware, gaming type channel here on YouTube. Been running this thing for a long time, and it's more of a labor of love. It's a fun thing for me, but today we're going in a completely different direction, an off-the-cuff vlog type video about my experience with Lasik Eye Surgery. I just got LASIK about 4 days ago. I had previously made a video and where I was selling equipment, specifically mining equipment, graphics cards, GPUs to pay for the LASIK, and we'll get into that in a minute and reasoning for that, but if you want to check out that video, it's above. So let's talk about what is LASIK and why I opted to go into the surgery. Again, I'm in day 4 of recovery. I had the surgery exactly pretty much to the hour, 4 days ago. Had my eyes cut, and I'm living in a world of haze at the moment, and we'll talk all about any of the side effects, any complications, which I do have a complication going on. We'll talk about that. We'll talk about what LASIK is, how to get the process started, the cost of LASIK, whether or not I think it's a good idea, and whether or not you should go down this path or consult a doctor. So yeah, let's just dive into it. So first and foremost, I have been a contact wearer or a glasses wearer for about half my natural life. The left eye has got pretty bad. Maybe it was like 2400 or something out of the left eye. The right eye is actually about only half as bad. It's pretty decent. My vision's only really bad at distance. The close-up vision has been really good. I could, without glasses or contacts, I could pick up a phone even with small text, or I could pick up a medicine bottle, read a label, no problem. So my close-up vision was never an issue. It's my distance vision. 100 feet, a sign with pretty big letters is pretty blurry for me. I got to the point where I'm tired of glasses. I'm tired of contacts. I'm a daily contact wearer, disposables. I wear glasses at night and on occasion when I need to. But it gets old. It gets old. I playing with kids, playing sports, doing activities, swimming, those kind of things. It gets real old wearing the contacts and glasses. So at some point I decided, okay, let's start researching this. Let's dig into it. Let's figure out what we can do to better our quality of life. That's basically what this is the QOL surgery. It's a quality of life surgery. So I reached out to my local eye institute to get the ball rolling. My local eye institute then set me up with a consult visit. Before that, they gave me some material to read, just basic overview of what LASIK is and whatnot. The consult visit was scheduled for, it took about 6 weeks just to get that consult visit in. At my specific eye institute, there's one main doctor that does all the LASIK surgery, and she only does it twice a month. So yeah, so it is in demand. So let's talk about what LASIK is before we go into the surgery itself. So LASIK basically is reshaping the eye using laser technology in order to gain better vision. And there's two different subshoots of that is LASIK is one side and PRK is the other. And both of these were discussed with my provider at the consult. And so first, let's just touch on what each is. LASIK, basically they have a machine that cuts a flap in your eye. It lifts that flap up, then moves you to the lasers. The lasers reshape the eye. The alternative is PRK. PRK, we'll put up on the screen what it stands for. It is a similar process, but instead of cutting the flap, a machine cutting the flap, they use basically a type of chemical to scrub that outside layer, those outside cells off of your eyeball, and then the lasers reshape. There are benefits to both sides. The PRK is more recommended for anyone that's into, that could take hits, right? Anybody that could be, that's into, say, a police officer. that could take a hit to the face. Whereas the LASIK, if you have just a flap, you need to be extra careful not to take any hits to the head, not to overexert. It could shift those flaps, they won't heal properly. Whereas the PRK, basically taking the whole layer off and then it grows back gradually. So there are pros and cons to both sides. Next, so that's what the surgery is, and then over time it corrects the vision. You can see much better. They said the statistics are something like 95% will be able to shed the glasses completely, never use glasses, not use glasses or contacts once you're completely healed up from the surgery. Eventually, they state that you'll need reading glasses, which everybody needs reading glasses once you get to a certain age anyway. So that for me was not a thing, not a problem. So next, we went ahead and got scheduled with consult. We went into the consult visit. What did the consult visit actually constitute? So for my specific experience, it was a 2.5 hour scheduled appointment. Yeah, the consult alone was 2.5 hours. I brought my most current prescription glasses. They recommend to bring your contact prescription or your glasses prescription or both. Bring those in, and they talk about what each option is, and then they look over your chart. They ask you a series of questions. If you get past those series of questions and they haven't eliminated you and you're still deemed a candidate, then they proceed with the additional testing. First, they set you down in the chair and do the standard eye doctor type setup where you sit in the chair. They bring down the big scope on you and you're looking at the wall, the lighted wall with the different letters, and they go through the different lenses, 1 better, 2 better, 3 better, 4 better. They do just to verify. They start with your prescription first, and then they go through all those and they verify what's the best vision for you. And this was all just the nurse. This wasn't the doctor for me. It was the nurse went through all that. Then once we finished with that, then we actually went to a number of machines. It's where you put your chin in. They have different lighted schemes, different objects to focus on, different letters or things to read, colors, all of that. There was 8 different machines that I actually had to put my chin in, put my head against, follow the directions, go through each and every one. Then we went back to the room again. The doctor this time went ahead and did the same eye tests with the big drop down things and the letters and the 1 or 2, the 2 or 3, went through all the lenses to verify the prescription. Then she dilated my eyes. Then she used the really bright white light coming across to scan the back of my eye, make sure there's no abnormalities or anything like that. Scanned all that, and then we went back through again, and she said, okay, you check all the boxes. You are a quality candidate for LASIK. You meet everything. You're also a quality candidate for PRK. And then she made sure that I'm not into any kind of activities where I'm gonna get hit in the head. It could loosen my LASIK flap. She said, so you qualify for LASIK. We're gonna go the LASIK route, but we also need you to be aware that if for some reason the machine cannot cut the flap properly, then we will switch over from LASIK to PRK on the fly on your surgery date. So that had me a little nervous. She said that there had been an instance before where they went in to do LASIK, the machine cut the one eye, made the flap just perfect, went to do the second, the machine could not make the flap properly at all on the second eyeball, and they actually did PRK. So they did PRK on one, LASIK on the other. Healing is similar. The PRK eye is gonna take longer to heal. So I kind of feel bad for that person because I bet that was really awkward because your eyes are probably healing at a different rate, and so yeah, there's all that. All right, so we've finished the consult. We had to go ahead and schedule. So again, we were dilated during the consult, so that's something to keep in mind in case you're driving, in case you need a ride to do the consult, or because you are getting dilated. I drove. I just make sure to have some good sunglasses and that you can handle the bright light with the dilation. So I went ahead and drove, and that was done. Then they followed up with me to schedule. We went ahead and scheduled the LASIK surgery. Again, it was like 6 weeks out to get scheduled in. One main provider doing all the scheduling. We got scheduled. One of the big things that we need to talk about is that LASIK is considered a cosmetic surgery. It's considered QOL surgery, a quality of life It's considered cosmetic because it's not necessity in insurance terms. On one hand, you would think that the insurance would want you to get corrective surgery so that you spend less on contacts, spend less on glasses, you have less eye exams and follow-ups and all that. But on the other hand, the insurance company wants to make money, so of course they want you to have glasses and contacts and extra visits. And so yeah, it's all the US insurance provider doctor game that we all live part of. So since it was not covered, let's go ahead into the cost. How much did it cost out of pocket for my eye surgery? They considered it $1,800 per eyeball. What does that cover? What does that cover in my instance? That covered the consult, that covered the surgery, the day after follow-up visit, that covers the 1 week follow-up, the 1 month, and the 6 month follow-up. So that's kind of a lot. That's kind of a lot of things. So the $1,800 sounds like a lot per eye out the gate. $3,600 out of pocket. Insurance would not cover any of it, but there is a lot that goes into it, counting the surgery, the doctor's time, the machinery, all the equipment. There is a lot to it. So now that's all the pre-work, all the everything I had to do before the surgery. It comes up to a few days before the surgery, and of course I've had appointment reminders and everything else that we're having the operation, and they call 3 days prior to make sure that payment has been made, because of course it's out of pocket. It's not coming from your insurance, so they need to verify that they're gonna get their money. So they charged me first, paid it, put it on credit card, got it all paid and ready to go. And then let's skip to the day of surgery. Day of surgery, you have to make sure that someone is gonna drive you, obviously. Before we ever even get to surgery, we already had 4 prescriptions put in after the consult, after the schedule, after we scheduled our visit, our operation. Once we scheduled, they went ahead and gave us 4 prescriptions. 1 is a steroid drop, 2 is an antibiotic drop, 3 is a pain drop for any kind of pain or discomfort, and 4th was Valium. It's a diazepam, which is a Valium. And if you're not familiar with Valium, it's something that just makes you happy. It makes you feel light. It's something that just it takes the edge off of anti-anxiety. People use it for anxiety sometimes. They gave me the 4 prescriptions. I picked them up. The 2 Valium, 5 milligrams a piece, were set aside, and they were told these are not to be touched until your day of surgery. You bring them with you. The 2 eye drops, the steroid and the antibiotic and the pain one, it was a gray cap for me for the pain. It was a tan cap for the antibiotic. 2 days prior, 4 times a day, start putting those in. You don't put them in together, so you put 1 set of drops and wait at least 5 minutes, so you do the other set of drops 4 times a day. That leads us clear up to surgery. Surgery, we need to bring all 4 of those medicines with us, the 3 different eye drops and the Valium. Get to the day of surgery. We have somebody drive us, obviously. There's no way you could drive home after this surgery. We went ahead in. My driver brought me there. We walked up the front desk. They checked me in relatively quickly. I get back there, discuss things with the doctor. They send me back to the room. First, you sign a waiver. Obviously, gotta sign the waiver saying that you're not gonna sue anybody if something goes wrong. They take me back to the room, and I think I'm gonna get surgery. Instead, there is a representative from the company that does the main machine that's hooked to the laser that does the main testing. And it is again, chin in, looking into it, and it looks like a ring of red lights, red dots all the way around, bunch of rings, ring, 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 ring. In the very center is yellow donut. You're staring with one eye at a time directly in that while that machine is taking really good imaging of your eye. The user said that they were unsatisfied with my previous scans and they redid both eye scans, and that before we ever got to the laser, they took me back to the room again to wait to where they process all those images, get it back into the machine for the laser, how it's gonna cut, what it's gonna do. So then finally they're satisfied, they got everything. They take me back, and before they take me back, they say, here, take a Valium. They gave me a 5 milligram Valium. They waited about another 15 minutes for it to kind of kick in, take the edge off a little bit. It really didn't do much for me because it was only just a tiny 5 milligram. We went back to lay down on the table. They washed my eyes, all around my eyes. Then they put some clear masking around both sides, laid me down on the table. Then the fun part, the fun happens, because of course you're fully awake during all this. The fun happens. You lay down, the doctor then puts some new drops in your eyes to numb your eyes up really good. Then they put a type of spreader to spread your eyes open, to keep them open. We're doing one eye at a time, right? So one eye at a time, they put those spreaders in there. It opens your eye completely. You couldn't blink if you wanted to. There's nothing you could do. Your eyes completely open. With the doctor kind of sitting up over top of you. The bed kind of moves a little. The machine comes down and you're staring into a machine and they're telling you to focus on the green light. There is a green cluster. It's a big cluster of green lights. Over here is a cluster of red, but you're staring at the green cluster and you're trying your best to just focus on that. As you're focusing on that, eventually it starts to dim. You feel a lot of pressure pushing down on your eye. That's the machine cutting the flap until you completely see darkness. You lose your vision completely. And the doctor warns you, it's completely natural, that's normal. It's putting so much pressure down on your eye while it's making that flap cut that it actually, your vision goes away. That lasts for 10 seconds, 15 seconds. It comes back up. You start seeing the green again. You're still staring at the green. Once they've finished that, they're satisfied with that, then the doctor starts using instruments on your eye, and I feel like she was pulling the flap back is what the instrument felt like. You couldn't feel it, but you could tell there was pressure. You could just see a super up close little instrument and the tips of her fingers. So yeah, pulled the flap back, covered that eye, rinse and repeat with the other eye. Cut both flaps. Flaps are cut to how they desire and they're flipped up and ready. Next, the machine, the bed, shifts about 6 feet over to the next machine. That's the machine that's gonna cut you. That's the one that does the lasers. So you're laying under the next machine. Again, you're focusing on something. Before you get started, they're doing one eye at a time. They put the spreader in. Before they move you over, they take the spreader out of the eye. Then they move you over, they put new drops in, they spread open the eye that they're gonna work on first. And then they go ahead and start the laser process. Again, you're staring at some lights. This time, it's a lot more intense. You can kind of hear the lasers cutting, sort of. They say that some people can smell. I didn't smell anything. There was no burning smell or burning sensation. There was no sensation other than a little bit of pressure. Once that was finished, the machine was finished, again, 20 seconds, 30 seconds. The doctor then starts using a tool and moving. I assume that's where they were putting flap back down, making sure that it was placed properly. They took the eyeball spreader out. They put an eye patch over, wash, rinse, and repeat with eye 2. And that was the surgery. That was completely done. Both of those were completely done. After they were done, you get up and it looks like you're underwater. Your eyes are open. You're looking around. It feels like you're underwater. Everything is literally that cloudy to where you look like you're underwater. They walk you back to the original nurse's room. They put you back in the chair. The doctor comes in. They look really closely at your eyes. They examine the flaps to make sure that they are in place properly. And then once they are satisfied with the flaps, they take you out front and they release you to whoever's driving you home. Of course, they give you instructions. They make sure that you have your eye drops and all that. The next step is I still had one 5 milligram Valium. They said, take that as soon as you get home. Take at least a 3 to 4 hour nap. When you wake up, your vision will be greatly improved. Start taking the eye drops, all 3 of them this time. You're gonna do the steroid, the antibiotic, and actually you only use the gray cap, the pain, if you need it. So then 4 times a day, but since it was already past the first time, 3 times a day for that, for the first day. Went home, took my nap, woke up, and it had greatly improved. I could see a lot better. The left eye didn't feel bad, felt pretty good. Everything's still pretty blurry, but way improved to where at least I can make out shapes and everything else. The right eye was pretty sore, really scratchy, really irritated. Did my drops the whole night like I was supposed to. They schedule you for a post-op very first thing the next morning. They want to make sure that everything is perfect. They're not just going to leave you out there in the wind. Make sure that those those flaps look good, everything's healing. The next day I decided to drive myself, 45-minute drive. Terrible idea, terrible idea. Tears kept streaming down, super bright, wore my sunglasses and everything. It was kind of dangerous. Don't drive on the post-op second day. Have somebody drive you. Take my word on it, pro tip. Okay, so we go into the post-op and I'm like, look, this eye is hurting. It's driving me crazy. It feels terrible. This one feels great. She inspects it really good. The diagnosis for this one was diagnosis cornea epithelioid defect, right eye, and then they did a procedure, a placement of a soft bandage contact lens in my right eye. So to promote healing, they put a clear air optics non-prescription contact in this eye that I am to leave in until my 1 week post-op. Let me tell you, it has been it helped a lot the first day, because no longer was my eyelid rubbing that raised bumped surface where that flap's not laying right, where it's scratched. But now I've had this contact in this is day 3, and that thing is super dry. I'm doing the eye drops like I'm supposed to, but it's very uncomfortable. Now let's talk about possible side effects. They give you warnings. You could have a multitude of different side effects that are short-term and long-term. For me so far, the only issues I've had is the scratched eye, the contact placement to heal the right eye. The left eye has been doing amazing. Every light source produces a halo effect around the light. So you'll have your main light with a white halo, or whatever color your light is, halo. Everything has a halo glow around it, which is to be expected. But the unexpected thing for me is that one eye is actually more like a prism halo. So instead of just the same light color, I'm getting like prism colors, like of the rainbow, all the way around the light source. Again, all to be expected. Sensitivity to light, extreme bright lights are pretty bad. Your vision will fade in and out, especially like when I first wake up, I can't see a lick. I can't see anything. My phone, I know there's notifications. I can see, I can't even tell who the notifications are from. From a distance, I can't see the giant letters on the clock when I first wake up. After an hour, half hour, it starts focusing in. My eyes start getting better. I can see pretty well. Like right now, towards the end of the day, I can see really well at a distance. My up close vision still not very great, way worse than it was, but my distance seems to be getting way better than it was. So they tell you that up to a month really is when the optimal healing occurs, and then you'll stop noticing any issues with your eyes, any halos. The vision really starts to hone in and focus. And so yeah, I'm hoping that it will just keep progressing every day, get better and better and better. Again, there are possible side effects where in the extreme cases you could get eye infection, vision issues long term. They do tell you that to expect to need reading glasses in the future. Obviously, I'm not concerned about that, because I'd rather wear reading glasses here and there, and 10 years down the road, have 10 years of glasses and contacts freedom, and then in 10 years, 15 years, start using reading glasses, you know? That's kind of natural anyway. As you get old, you have to wear glasses, so contacts and reading glasses and all that. So yeah, that's where I'm at. I have a 1 week post-op scheduled. I have a 1 month that I'll have to do. And then I believe not until 6 months. I don't think I have a 3 month, but we'll see after my next visit. I just wanted to kind of do a vlog style to inform basically. If you're interested in LASIK, this is how it is. This is my experience with it, and it's different for everyone. At least some of the things can be different for everyone. How the vision, how your eyeballs react to the surgery, how quickly you heal, any side effects, all of that is kind of dependent on how your vision is, your anatomy, you know, your genetic makeup, whatever. Like those things all can vary slightly, but these main effects like the halos, everything's kind of hazy, especially around a light source, completely normal, should go away over time. Yeah, this is my LASIK journey, my LASIK experience, and I just wanted to share it with you. And if you're not one of my subscribers, make sure to subscribe. If you have questions or concerns, comment down in the comment section. I would love to hear your journey. Have you had LASIK? Are you considering having LASIK or another type of corrective surgery? share your experience with me, with the world. These kind of things just help others. They help other people, and I think that's what it's about, you know, putting some good out there in the sphere. And if you're interested in any kind of crypto or tech or mining or hardware, make sure you subscribe, and maybe if this video does well enough, maybe I'll do a follow-up video and discuss where I'm at in 1 week, in 1 month, in 6 months, and we'll vlog it, we'll talk about it, and we'll tell you our experience, because, you know, let's do it. So yeah, again, if you like the video, you know what to do. Smash that like button and subscribe for future content. Thanks for coming along, and enjoy the ride.